DocTalk is brought to you by Merck Animal Health. At Merck Animal Health, we're shaping the future of animal health with pioneering science, connected technology, and insights-driven solutions to bring our customers an unparalleled portfolio of choices to improve cattle care and operational efficiency. We support you and your legacy by helping you meet the challenges of today with the innovations of tomorrow.
Hey folks, welcome to DocTalk. We're going to have a great show. We have Dr. Tim Parks on the show today, and we're going to talk about preconditioning calves, prepping them for the feed yard, talking about the value, how we do it, why we do it, and so much more. It's great to have him on the show, and we'll be right back after these messages.
They're here, they're hungry, and they can't be stopped with ivermectin. Choose Safeguard when you deworm your cattle to take out resistant parasites like brown stomach worm, Cooperia, Nematodirus, and others. With Safeguard's efficacy, you can kill more resistant worms in your cattle, so you don't leave potential on the table. Consult your veterinarian for the diagnosis and treatment of parasitism, then bite back at safeguardworks.com.
Hey folks, welcome to DocTalk. I'm Dr. Dan Thomson, and I'm here with my friend and colleague, Dr. Tim Parks, who's a veterinarian and a technical services manager for Merck Animal Health. Sees a lot of cattle. He's been in private practice in Northeast Kansas for most of his career. He has a bigger stage now to amplify his message on cattle health, and we're thankful you're on the show.
Thank you. Appreciate the opportunity.
Yep. And Dr. Tim, you know, we hear a lot of talk about preparing the calf for the next segment of the industry.
Yep.
And so let's talk a little bit about why.
You know, when we look at where that calf's headed, we know where it's starting, where it's headed. Ultimately, we got to get it to the end point. And the end point usually is going to be at the feed yard level. We've got to make sure we have a healthy animal there. We're sitting at a time frame where cattle prices are high, cattle numbers are down. Everybody wants the animals to perform, and what we do in the early stages, just trying to get them ready for it. Like you said, we got to get them ready for production.
Yep.
But that's the key. We've got to prepare them, and that starts early. The sooner we start preparing them, the better chance they have to get to that point. One of the things we see, and you go to the feed yards all the time, to build a big pen of cattle, it takes a lot of farms. You know, back in 2017, 54% of the cow herds were less than 20 head. It takes a lot of 20 head herds to build a pen. So commingling all those animals, that's where all the health problems, you know, that's where it starts. So if we can do anything to set them up, get them ready for that, their chance of success just greatly increases. So that's ultimately the goal. We want a good product at the end, a healthy animal when we get to that end point, just so we have we provide a good product for our consumer.
Yeah, and you'd kind of talked earlier that, you know, that it starts and begins selecting the genetics and getting the calf on the ground, and every day forward is the one that we're maintaining the potential for that optimum performance.
You bet. So the cow-calf man, they're doing the bull selection, the heifer selection. They're creating that baby, and the genetics that are going to determine the end point, the people that are going to feed them out may or may not be that same person. So if they set that animal up for that type of success, the other things they do, preparing it health-wise to achieve that end goal, really becomes important. So it does go back and start, you know, everything really starts at that cow-calf level, creating the pregnancy, getting that live calf on the ground, and then starting the immune system and getting it ready for what it's going to be up against as we go through.
Because every one of those small herds has a little different bug or a little different strain.
Yep.
And now it's just like throwing kindergartners
Yeah, and that's the best
right?
that's the best example you can give. It's the first day of kindergarten. I still remember you talking about do away with kindergarten roundup. That's the abrupt wean right
Yep.
there. That's the abrupt wean, and it's not just the vaccines getting them ready. It's the other things that come into play. It's the nutrition that we start at the start. It's what have we done with that cow herd? What did we do to prepare that cow herd to develop a base level of immunity in that cow herd to where now we've created opportunities for us as we move through that cow-calf level. So there's all kinds of things that come into play. We know we're going to put a bunch of them together. There's going to be bugs, there's going to be disease challenge. We got to try to minimize the negative impact of that challenge.
Dr. Upson, who taught both of us, always said there's two reasons why animals get sick. an overwhelming dose of a new pathogen or a suppressed immune system.
Yep.
And
they can both happen, and they both happen when we start the commingle, and it's right at that weaning time. So what we can do prior to weaning really helps us set up for success later.
it's perfect. We're going to take a break. When we come back, more with Dr. Tim Parks right after these messages.
Hi, my name is Dr. Kirk Ramsey with Neogen. Today on Cattle Intel, we're going to talk about selecting needles for synchronization protocols. Synchronization protocols always require a hormone injection. And there are a few really important factors that we have to remember when approaching hormone injections in cattle. All hormone injections of prostaglandin analogs have to be given in the muscle. If those injections fail to get in the muscle, they're definitely not going to be as effective, and they're probably going to lead to synchronization failure. This means that depending on the animal's size, needle length and gauge are really important. Probably the best rule of thumb is just to stick with a 1.5-inch needle for intramuscular injections of hormones. Gauge of the needle is a little bit less critical, but the longer the needle, the more likely they are to bend or break, making these injections dangerous to the injector as well as the animal. For most cattle injections, you should probably stick with an 18 gauge, or often a 16 gauge is preferred. When giving these injections, always follow beef quality assurance guidelines for injection sites. This means that the injections are best given in the muscles of the neck. Last, remember, hormones associated with cattle synchronization can be very dangerous. It's good practice not to handle these hormones if you are pregnant or may be pregnant. And always wear gloves and protective equipment when giving these injections. Hopefully these tips have been helpful, and if you have further questions, you can always follow up with your local veterinarian.
Thanks for watching Cattle Intel by Neogen.
Are you a cattle feeder looking to manage for a stronger and more profitable set of cattle? Look no further than Igenity Feeder. Igenity Feeder utilizes DNA to gain insight into your cattle's genomic potential, with the information to predict performance, quality, and economic endpoints for cattle feeders. Animals are scored and ranked in a simple format, driving more precise and accurate management decisions. Igenity Feeder gives you the power to predict days on feed, manage variability within lots, characterize carcass performance, and focus on metrics important to you and your operation. With the data provided, you will identify superior animals earlier and maintain high operational efficiency. Maximize your profit and optimize performance with Igenity Feeder.
This fall, Rodrigo with Fera came to me and wanted me to try this product. Since then, our medicine bills went to nothing. This is not an antibiotic. It makes your cattle keep hydrated. It makes your antibiotics and your drugs work like they should. We went from doctoring 40% of them last November to almost nothing. This is not a paid advertisement. This is good stuff. If you want to make some money, buy you some little calves, use this Fera and save a lot. It is the best product I've ever used.
Hey folks, welcome back to DocTalk. Dr. Dan Thomson here with Dr. Tim Parks, and we're in Lenexa, Kansas, and we're here. Dr. Parks serves as a technical services manager for Merck Animal Health, and he's a tremendous cow, calf, and feedlot veterinarian, and somebody that I call frequently for advice when I get tripped up on cases or need some help, and he's is a wealth of information. When we left, we were talking about why we do it. So let's start to get into some of the nuts and bolts on how, and okay. I would reckon we'd start at branding, or that 3 to 5 months of age.
Yeah, we're, you know, that turnout branding, whatever part of the country you're in, whatever you call that, when we're getting ready to move that animal out on, generally onto summer grass, the things that we can do at that time, you know, we've always looked at vaccinating calves around 3 months of age. It goes back to the impact that maternal antibodies can have on our vaccines. Do we have that opportunity for blockade of the vaccine accomplishing what we want to and getting the immunization that we want? So it's really changed a lot with intranasal vaccines like Bovilis Nasalgen 3 and some of those products because of the way they stimulate the immune system. So we've started to see them interact with these calves at an earlier age. But it's this time frame where we can really set that immune system up. We got to create memory. If we can create immunologic memory, we've set that animal up for a lot of benefits as we think about the other opportunities that we're going to have to interact with it. But it really starts with that cow herd. Make sure that we got those cows vaccinated to where it creates the opportunity for us to handle the animals the way we need to. I always tell producers, you and I could build the best vaccine protocol for them and tell them this is what you need to do, but if it doesn't fit their management scheme, it's not going to work. So it's really important that you work with your veterinarian and any of these programs to make sure that the program that we set up is going to fit into what you're capable of applying management-wise to that group of animals. Otherwise, we're not going to have the success we want.
It's kind of like when you walk out there and somebody says, I want you to castrate this bull. And you don't understand all the things in the Rolodex that are going through your brain of how big that is, bull is, what kind of facilities we have, expertise, time of year, and that's what you're saying on picking this branding program, right?
Yep, we've just got to make sure if this management section allows us to get our hands on those animals twice a year, we've got to make sure that we can set up what we need to give the best results with those 2 times a year we have our hands on those animals. Because it's really this time frame at that branding age, we've got to stimulate that memory. If we can get memory, it creates the opportunity for pre-wean or wean whenever that next time we get our hands on them may be. It's just a really, really good opportunity to set those calves up.
So what are some of the core things that you like to see done at that branding time?
You know, we've got to address the viruses. We want to create IBR, the BVDs, BRSV, PI3. We want to stimulate good immunity against those. Create active immunity, create memory, and we can do that with some of the newer vaccines that have come out, especially as we look at the intranasals. Clostridial diseases, we got to get that in there and make sure that we're stimulating the immunity, creating that memory that we need. Mannheimia and Pasteurella, the most common bugs that we're going to come across that we know cause disease in these animals. Get started on that because we're going to start to see maternal antibodies dropping at this time frame. So anything that we can do to start getting some active immunity to bridge that time frame becomes really, really important.
And you know, steroid implants at this time is pretty critical.
Yep, the biggest, you know, the only person that's going to benefit from that steroid implant in that suckling calf is the person that owns that suckling calf.
Yep.
You know, put it in, see that 20 to 30 pounds advantage, let it carry through because it's going to carry through that calf's life, but pick up that extra $1. In today's market, that's a pretty good check.
It's a great check. Folks, it's great information. Always good to have Dr. Tim Parks on the show. We're going to take a break. When we come back, we're going to talk about pre-weaning protocols. You're watching DocTalk, and we're glad you joined us.
Every farmer knows that understanding the landscape is the most important ingredient for success. When it comes to investing in precious metals, United Patriot Coin can help steer you in the right direction. No obligation, just solid advice. Call now for your free guide, 844-202-7834.
Success in the cattle business hinges on a lot of different people playing their part. From the vet to the cowboy and the nutritionist to the feed truck driver, you rely on them to get their job done right, and so do your cattle. Your expectations for the vaccines you use should be no different. Bimeta's cattle vaccines were developed and are made and sold by men and women in the cattle business. No smoke and mirrors, just real-world protection that you can rely on. Go to BimetaBiologicals.com to learn more.
In the livestock industry, castration is a common practice to ensure proper herd management. All methods are painful, regardless of the age of the animal. At Solvit, we could not ignore the clear industry need for better castration solutions. So we developed LidoBand, a novel lidocaine-impregnated elastrator, addressing the pain associated with band castration. It provides local anesthesia throughout the castration process. LidoBand, a small device that can make a big difference.
Ranchers, looking to elevate your pasture management game? Turn to Heinen Brothers for expert aerial application. With state-of-the-art equipment and seasoned pilots, we deliver precision treatments right to your fields. From fertilizers to herbicides, Heinen Brothers has your pasture covered. Visit HeinenBrosAg.com to learn more.
When the ones who have your heart need your help, count on us for everything they deserve, delivered fast. We'll work hard for you so you can work hard for your dreams.
Hey folks, welcome back to DocTalk. Dr. Dan Thomson here with my friend and colleague, Dr. Tim Parks. We've got through branding, we've turned them out. Now the grass is starting to fade away.
We're going to bring them in. So now, early we created memory. We created some immunologic memory. We started to prepare that animal. But now we're 4 or 5 months down the road. We need to get a booster in them. We need that amnestic response that really builds that protection that we need. If we can do it prior to weaning, great opportunity for us to do it. If we can do pre-weaning, because there's something about the, just the presence of mom, everything's calmer. We know cattle that are low stress, their immune system is going to respond better. But like you said, grass is dropping off, vitamin mineral levels are dropping off, parasite loads increase. There's a lot of challenges there. So now we need to boost those vaccines, but we really need to prepare them. And one of those things, we've got to deworm them. We've got to get a good deworming. And they've picked up worms over the spring and summer. We got to clean them out because it has a negative impact on our immune system as well. So making sure that we get a good dewormer in. And, we like the drench wormers like Safeguard, the fenbendazole products, get in there, clean them out really well. And then let's go ahead and get the vaccines in them at the same time. And the vaccines, now we're going to boost what we started. So boost those viral vaccines. So, at Merck, we always like to start with the intranasal in those babies and give a Bovilis Nasalgen 3 PMH. And then at weaning, we can come back with Vista once and get a really nice amnestic response. And all you're doing is you're just building on what you did up here. But we're doing it at a time frame where we know if we do it in a pre-wean window, we know we're 14, 21 days away from when that calf's going to have a major life change.
Yep.
And weaning time frame's it. It's probably the first time it's going to see the truck and go to a different location. It's going to hit the kindergarten stage. We're going to start to see all those disease challenges. So what we do now is really the key. And we got to boost the clostridials as well because a lot of people down the road may not.
Yep. So clean them up with parasites and then our vaccines. And one thing you made mention on the intranasals, and I always tell our producers and veterinarians that the intranasals don't have the BVD antigen. And so when you do the calf vaccination program or the branding and you want BVD in there, we're gonna have to give them the injectable BVD with the intranasal.
You bet.
So just as a caution, besides vaccinations and deworming, this is a good time to get them on feed and get them trained to the bunk and get them trained to, some different things during that preconditioning program, correct?
That's right. And this is one of those things, we've run into it in a couple cases over the last couple of years because of drought. Hopefully we have a marketing plan in place, and usually that marketing plan is going to involve a wean. Prime Vac 45 cattle are going to be weaned for 45 days. The precondition programs that we kind of represent with Merck, they're going to be weaned for 45 days. Droughts may change that. So it goes back to your BVD. We need to make sure we put it in up front because we may have to alter our plans as we move through. But as we get out to that time frame, we're going to get that wean. And I really feel like we either need to wean for 45 days, get those cattle bunk broke, make sure they're eating good and they're ready to move. We don't want to move them 14 to 21 days after a wean. It's a very critical time frame. It can cause a lot of problems. So 45-day weans is really where we start to see, 45 to 60, you're going to start to see the advantage, and the buyers really see the advantage.
It's outstanding. It's great information. When we come back, we're going to talk about the value that these types of programs bring you as a producer. You're watching DocTalk. We're glad you joined us.
Hey, I'm Clark Victory. I grew up right here on this little ranch near Chelsea, Oklahoma. Roped and ranched all my life. A few years ago, I had an injury that created what they call a frozen shoulder. And after speaking with the surgeon in Tulsa, he told me that he could make my shoulder better if he did surgery, but he absolutely couldn't fix it. And I called Kansas Regenerative Medical Center. I did the stem cell replacement. By 12:30, my wife and I had lunch and was driving back to Chelsea. We work around here. Some days we work pretty hard around here, and my right shoulder doesn't get sore. It's like a baby's arm.
Hey folks, when we talk about intranasal products, having the right nozzle is important, and Merck has a new what they call CleanVax nozzle that's outstanding for administering Nasalgen. It has a nozzle that helps with the direction and application of the vaccine in the nose, and if you want to receive a free package of CleanVax nozzles, go to valleyvet.com, and between now through the end of September, anytime you order Nasalgen products and you use the promo code DocTalk, they will send you a free package of the CleanVax nozzles. Hope you're enjoying it, they work, and we'll see you down the road. Hey folks, for your firearm and ammo needs, for gun safes and much, much more, and to have it personalized, come visit us at United Patriot Supply outside of Seneca, Kansas. You can also visit us online at unitedpatriotsupply.com. Be sure to say that Dr. Dan and DocTalk sent you, and we'll see you down the road.
Time is money on the farm, and your cows are less productive when they're stressed. The Alertus on-farm test from IDEX allows you to quickly test cow side and identify open or pregnant cows within minutes on your schedule in the parlor, barn, or chute. It's more efficient for your farm, very simple to use, and puts you in control. With minimal training and reliable, fast results, sample-based pregnancy testing is better for beef and dairy producers. Learn more at idex.com/DocTalk.
Hey folks, welcome back to DocTalk. Dr. Dan Thomson here with Dr. Tim Parks. And Dr. Parks is a bovine veterinarian that serves as a technical services manager for Merck Animal Health. Tremendous wealth of information as he has been in veterinary practice for many years, helping a lot of producers in Northeast Kansas and now helping a lot of us veterinarians and producers all around the country deal with cows, calves, feedlots, and the sort. Merck has offered you said Primevac 45 and some of these different types of preconditioning program. Let's talk a little bit about the value that these, when we do it right and our calves perform, cattle feeders pay more.
Yep, they do. Especially, you're in a market like this, when they're paying $1,800 for a calf, they want it to live. So anything that we can do is going to benefit them. We've had the opportunity to work with some of the video auctions and evaluate some data out of some of their sales. And back in 2020, we were seeing about a $7.50 per hundred advantage on cattle that were Primevac 45 cattle that had received all vaccines, been weaned for 45 days. One really neat thing about the data set that we saw was the baseline's no longer non-vaccinated. The baseline, or at least calves that received that branding or turnout shot. So that's a step in the right direction as far as I'm concerned with our industry, that we're getting there. But we're seeing some value in that side. One of the things that we look at what has negative impacts on the value. We know that bulls at 550 pounds are going to have a negative impact on the value, so things that we do prior to that. Pre-vac is a positive value. Implanting doesn't affect sale price. If they implant it as a baby, it doesn't affect sale price, other than they're just selling more weight.
Yeah.
They're selling more weight. So there's a lot of advantages that we see as we go through there with what the buyers are willing to pay for those cattle.
And the reason why they're willing to pay more is because we're having better performance, better health, and
everything all the way through. Performance is better. They're healthier. We think about cattle and compare them to horses. Cattle are running on a lot less lung capacity. They got a great big rumen that's taking up so much room, and then a lot of times we're going to have them in some environments that are not conducive to good lung health. We think about how dusty some of the feed yards can get. So anything we can do in the early stages to prepare them and really protect that lung to where we're not having a lot of lung damage as we go into the feedlot really sets them up. People that buy these pre-vac cattle, they don't have to spend as much money on antibiotics. The health is better. The performance is better, and performance and everything together. It's just there's more value to those animals.
What about labor? and these calves coming into a yard?
You know, a lot of these cattle, as they come into the feed yard, if they're pre-vac cattle, they are going to manage them a little bit different because they know what they've had, especially if it's been documented. And one thing that we can't say enough about is the documentation behind it. We've got to make sure that we're documenting that and present that to the buyers so they know what they've had. Now you've reduced the labor. Instead of pulling sick cattle, they can do other things. They can feed cattle, they can maintain the pens, they can do the other things that they need to do. And labor's a concern anywhere you go. So anything that we can do.
As we see the labor decrease, it just increases the value of these preconditioned calves even more.
You bet, you bet.
Because there's only so many hours in the day and there's only so many people to do it. And these animals aren't cheap and our input costs aren't either.
Yeah, anything that people can do at that time frame that we can set that calf up for success in this manner, it opens up the labor to where they can just handle them much easier. Yep. It's not just labor, it's skilled labor, it's the whole thing across the board. Anything that we can do all the way through to lessen that load at the labor level and make everybody a bit happier.
Thanks for being on the show today.
Thank you very much.
Thank you for watching. Remember, if you want to find us, you can find us on the web at www.doctalktv.com. Always work with your local veterinarian. I'm Dr. Dan Thomson with Dr. Tim Parks, and we'll see you down the road.
At Merck Animal Health, we support you and your legacy by helping you meet the challenges of today with the innovations of tomorrow.